During the AORTIC this next month, I'll be coordinating and moderating two sessions. One is the palliative care interested group session, where we have different speakers from African continent talking about impact of COVID-19 in palliative care. So we expect during this session to understand more how the COVID-19 really impacted the palliative care services and program, which was already fragile in the Africa continent. But we expect also to generate some solutions and the recommendation, especially for cancer patients who are really suffering a lot. So the second session will be on November 7th, where we will also discussing another group of physicians. It will be a multidisciplinary team where we have also patient's voice and people working with the patients, and also try to understand one, impact also for COVID-19 at the community level. Second, how patients' voice can make a difference. Where we are now in terms of advocacy, not advocacy at the high level, because we can have advocacy on the high level, but does not really impact at the community level. And also to hear also from other speakers what they think could be the best solutions in the coming years, especially after COVID-19, how African continent, also Africa countries, palliative care specialists, and all the multidisciplinary team can work together and bring a very sustainable model of care, which is really respected the dignity of the patient, which is localized based on the local context, contextualized as well, but also increasing the need of a research in the continent. Palliative care is still challenging in the continent. It's still challenging in most of countries, despite some effort have been made by the government and also African experts. And we need also to realize, especially after the COVID-19, I can say after, but say during this COVID-19 situation, we need to rethink about the palliative care approach we are doing, and also to question ourselves, is it the right approach? Is it the best model of care? What's the challenge we have now? Because now we are facing a huge challenge. It's not only access to morphine, but the COVID-19 showing us that the challenge is more than access to the morphine. And that we need also to figure out about what will be the future on palliative care in Africa continent, especially among cancer patients. How can we integrate palliative care in our public health system, and also how kind of research which could be contextualized will be helpful for the patient and family members. So those are some of the challenges where the continent's really facing, but also it's also an opportunity for change. Maybe the lesson learned during this pandemic situation will bring us or leverage us another way of thinking of palliative care by investing in more in the community, investing in people, investing on our model, which is really appropriate on the Africa continent, which are not duplicate the model from our colleague from Western countries, sometimes conflicting with a perception of death, dying, and the end of life. So we hope through this AORTIC conference to gain more experiences from colleagues, but also to generate more solutions for our population.